Millions of adults walk around every day with a cardiovascular system operating under immense, dangerous pressure. High blood pressure forces the heart to work overtime, placing severe, silent stress on the body, often without a single noticeable symptom. To neutralize this threat, doctors turn to a reliable first-line defense: thiazide diuretics. Medications like hydrochlorothiazide and Chlorthalidone are highly effective at bringing that pressure down to safe levels. Because they work so well, these prescriptions are ubiquitous. A staggering portion of the global adult population takes a thiazide diuretic every single morning to protect their heart. When a drug is this critical to human survival, any hidden downsides affect millions of people. Patients rely on these medications to stay alive, meaning they cannot simply abandon their prescriptions when unexpected physical issues arise. A massive study in JAMA Internal Medicine tracked 81,000 women. Filtering the data into thiazide users versus non-users, an unexpected anomaly emerged. Long-term users showed a meaningfully elevated relative risk of needing surgical gallbladder removal compared to non-users. This finding represents an observational signal. It proves a strong correlation exists across a large population, though it does not guarantee that every individual patient on a thiazide will develop gallstones. This forces a difficult balancing act. Patients must weigh the unquestionable, life-saving cardiovascular benefits of their daily medication against an invisible, creeping risk to their gastrointestinal system. To understand this heart medication's effect on digestion, we must look at its primary mechanism. Thiazides target the kidneys, flushing out excess sodium and water. Decreasing the overall fluid volume in the bloodstream successfully lowers the physical pressure pushing against the walls of the arteries. Researchers propose this altered fluid processing causes a downstream reaction, making gallbladder bile lithogenic, meaning its chemical equilibrium is lost. This unbalanced bile easily crystallizes. Over time, these microscopic crystals merge into solid gallstones. Manipulating the body's hydration mechanics in the kidneys sets off a biological chain reaction, ultimately altering the chemistry of the gallbladder. The clinical data points to a specific patient profile at the highest risk: individuals who have been on high-dose thiazide therapy for several consecutive years. This baseline risk compounds with other specific vulnerabilities, including clinical obesity, recent rapid weight loss, or family history of gallbladder issues. As the chemistry of the bile begins to shift, the body sends no immediate alarms. These early physical changes happen entirely without pain. The first subtle warning sign is usually dietary, a sudden new sensitivity that occurs only after eating fatty or rich foods. This is often followed by physical indicators. Patients may experience a dull discomfort in the upper right quadrant of their abdomen, along with a heavy bloating that feels disproportionate to the meal they just finished. There can also be a clear visual indicator in the bathroom, with stool color noticeably fading toward lighter, clay-light shades. Because every single one of these symptoms perfectly mimics generic indigestion, recognizing these specific warning signs is the only way a patient can catch the drug's side effect before it escalates to the point of surgery. If you match this profile or recognize these symptoms, there is an absolute medical baseline you must follow. Never stop taking your blood pressure medication without a prescribing doctor's explicit guidance. Uncontrolled hypertension is an immediate, fatal threat to your life. Gallbladder changes, by contrast, require a steady clinical evaluation, like an abdominal ultrasound, to manage safely alongside your primary care. If you confirm your medication is compromising your natural bile, you can establish a digestive workaround. By proactively taking targeted supplements, you can support your intestine's ability to emulsify fats directly during digestion. Managing the side effects of your life-saving drugs, rather than abandoning your treatment, is how a proactive patient takes control of their long-term health. Medisyn Labs develops targeted dietary supplements designed specifically to support this exact digestive gap. Their core product, Gallavance Original, uses a bile-anchored formula in delayed-release capsules. This ensures ingredients like ox bile extract and phosphatidylcholine open directly in the intestines, precisely where fat digestion takes place. For consumers who require targeted bile support but want to avoid animal-derived ingredients, they also produce an alternative formulation, Gallavance plant-based. Protecting your health over the long term requires understanding the full systemic impact of the medications you take. With the right information, you can confidently protect your heart while giving your digestive system the exact targeted support it needs to process your meals. Note that these statements have not been evaluated by the Food and Drug Administration, and this product is not intended to diagnose, treat, cure, or prevent any disease.